once you're homeless and you grew up on the streets, you see things that's not right. You need help, but there's no help.
I got assaulted by the neighborhood watch about last week. They damaged the right side of my brain. I got a fit the day after that.
The most challenge that I'm facing is how people treat us, especially we women that are using drugs, is that the stigma that we get from our communities.
And it was very hard also seeing my child in the street. If I've got 10 rand, I throw 10 rand on the street, so we come running. In the taxi, they were asking why. I told them it's my son. It was very, very painful for me.
I was on and off the streets in shelters almost 30 years.
As people use drugs, we are marginalized a lot of the time because of what we choose to put in our bodies.
During the 2016 year, we had tests again. What happened is they told me I'm duly infected. I've got hepatitis C and HIV.
People who come from very vulnerable population groupings could be considered as denizens. They don't have full citizenship in this country. You know, they don't have full access to healthcare services because they're not seen as eligible almost for the rights that other people have.
And I think we have to talk about the elephant in the room. And the elephant in the room is probably stigma.
So the reality at the moment in 2020 is that we have a few harm reduction programs that include opioid substitution therapy, they include needle syringe services, and to some degree include some hepatitis screening and testing. But they're only in very few major metropolitan areas. And even in those cities where we do have those services, there's great further room for integration, and all of them have concerns to threats of sustainability.
Substance users did not have access to the services that we are providing. The only thing they knew was rehab. And the success rate, especially when it comes to heroin, was very low. We actually give all the information and they decide, they set their own goals, and it's our job to help them reach those goals.
What I normally do on a daily basis when I come out in the field giving out needles, the needle syringe program, and I also do behavior change interventions. When we normally give out the needles, we'd normally tell people about safer injecting.
The harm reduction program is so important. It helps us a lot not to spread HIV and hepatitis.
I would say my health is important. You know, I've come across so many risky challenges, especially with needles. I know that each and every fix I get, I must use a new needle.
But for some people, it's like we're encouraging people to spike up. They got the wrong mindset around that clean needles. And the reason TB HIV is giving that clean needle is try to stop spreading Hep C, AIDS. There's a lot of things that goes with that clean needle.
I would say some years ago, people were not aware that there are actually ways of dealing with substance use. There was really a despondency.
As there was no awareness on Hep C, and then that's when I started to worry about everything until recently.
Kuketsu for me is quite inspiring in the way that he's persisted in educating even before we had access to treatment.
It started in January, and then I was patient 0. I'm the first patient in the project.
I believe that a positive outcome for him will really be a new chapter in his life.
Being treated with hepatitis C and being cleared of it has given me just so much hope, absolutely, so much hope in life.
I think for someone like Jennifer, what is important is that one doesn't see this through the lens of just some sort of a medical model. It's a treatment, harm reduction, and social support combination.
And what makes me proud of Jenny is she's in the cleanup. She's earning a little money, but from that money, she uses it wisely. She's paying a shelter fees.
I've overcome all these challenges. I've overcome living on the streets. I got myself off the streets. I found myself a job. I started running again. I overcame the HIV threat. Now finally I'm going to go overcome the Hep C threat. There is nothing that I cannot do.
My dream is to see more centres like this. One on every corner.
Because it's working. And I am a product to show that it does work.
I believe we are sitting at a juncture in South Africa, and unless you actually realize that if you don't climb in now, the longer you sit on your hands and do nothing, it only becomes a bigger problem. We learned the hard way with HIV.
I think OST or harm reduction services must be part of the essential list of medicines so that we can get cheaper methadone.
You know, if we're wanting to create a space of less harm for people who use drugs, it's really in the sort of space of ideology that we need to be working. Then we get a critical shift in understanding who people who use drugs are. And so caring means understanding the humanity of people who we've kicked aside onto the streets and into the prisons.
We know what the problems are, and we have the solutions to start overcoming these challenges. What we need is societal support and political action now.